Well, we actually screen for dry eyes on every patient that comes into the office because it's so prevalent. Estimates are between 20 and 30% of the population have issues with dry eyes. But we're starting to see that it's even higher than that because of our reliance so much on digital devices, the changes in our hormones, and issues with the medications that we take. But the way that we do this is that I listen to what the patients tell me. I ask them some very specific questions about their eyes. I want to know if their eyes are feeling good, if there's any itching, burning, gritty feeling, if their eyes ever feel dry, if they water, or if they notice that sometimes the vision gets blurry and they blink and it clears up. Those are all hallmarks for dry eyes, and particularly meibomian gland dysfunction. And the other thing that we do when we're examining a patient is I look at the lid margin. I see if there's any kind of buildup of biofilm on there. And I also express the glands in the eyelid by just gently pushing on the eyelid and watching what comes out. It should be a nice, clear fluid. It should be about the consistency of olive oil. And when it gets cloudy, then I know that I'm starting to get issues with it. If it's thicker, it can even get as thick as toothpaste when I push on those glands. I know that I've got a problem with meibomian gland dysfunction and dry eyes. So when we identify someone who has potential issues with that, we bring them back for some additional tests. One of the mainstays that we use for looking at the meibomian gland is actually imaging the glands with a procedure called meibography, where we actually can take a picture of the glands. We actually see the structure. We can determine how much swelling there is, how restricted the glands are, how much recession we've had in those glands. And once those glands are gone, I can't bring them back. But if the glands are there, then I got things that I can do to make those glands work better. We also use some different tests, for example, inflammatory, where we actually are looking for a marker for inflammation. And we also are using different dyes, a yellow dye and a green dye that we place in the eye to see how that how it absorbs onto the surface of the eye, so we can tell if there's irritation that even the patient may not be aware of.